Rebels, 2 of my access to information requests are still outstanding, and it's frustrating. As soon as the government wants data on you, whether it be your vaccination status or your tax information, they say jump and expect you to say, how high? But when they have something that they don't really want to give up, it's runaround city. For Rebel News, I'm Tamara Ugolini, and I wanted to do a quick summary and reminder video about my ongoing access to information requests. Way back at the end of October 2020, I filed a Freedom of Information request with the Ministry of Health and the Ministry of Long-Term Care. At that time, I had been investigating the series of events that happened at Pinecrest Nursing Home in Bobcaygeon, Ontario, where they lost nearly half of their residents in a 2.5-week period, allegedly due to COVID-19, but under extremely questionable circumstances. See, under the directive of Pinecrest's medical director, that's Michelle Snar, who described herself as a field commander in a war, where she also stated that she emailed families on March 21st, warning them that they may have to decide on sending a loved one to the hospital or placing them on a ventilator. The latter of which, Snar said, would likely cause a patient to suffer a great deal, adding that they may not survive. In the same article, Mary Carr, that's Pinecrest administrator, says that residents were, quote, isolated in the home, end quote. In this Globe and Mail article, it quotes Dr. Michelle Snar, again, that's Pinecrest's medical director, as saying that residents or their next of kin had the final say on whether they went to hospital. But in the end, all 29 died at Pinecrest with oxygen and morphine to keep them comfortable. It continues on that many were alone when they took their last breath. Again, this is in 2.5 weeks. And when I reached out to Pinecrest for comment and clarification on these articles, I received a response from Janelle Wallen, who is another one of Pinecrest administrators. She told me in an email that during the outbreak at Pinecrest Nursing Home, their leadership team had daily conversations with public health, the Ministries of Health and of Long-Term Care, and other health system partners. I have it in writing. So when my Freedom of Information request came back that, quote, no responsive records were located, end quote, I couldn't believe it. Sheila Bristow, she's the Assistant Deputy Minister of Long-Term Care Operations Division, was responsible for that decision. And for what it's worth, Sheila's LinkedIn shows that she began her position at the Ministry of Long-Term Care Operations Division in June 2020, and before that, she worked as the Assistant Deputy Attorney General. With all the legalities surrounding the issues in long-term care, this seems like an interesting overlap of job positions for Sheila Bristow. So, of course, we appealed her decision. I mean, I have it in writing that these communications allegedly took place, but I want to know what was said and why. That's what a journalist does. So on June 24th, I finally received an email confirming my notice of appeal. It has been 8 months, and there's no end in sight for this Freedom of Information request, as sad as that may be. And it takes time to sift through this process and figure out what is going on and how to stay on top of the progress, if any. To support this important journalistic work, please head over to rebelinvestigates.com. These types of requests take time and funds, and not to mention a lot of patience. And since we don't get government bailout funding like the mainstream media, we rely on the generosity of our donors to support this kind of work. Now, on to my other Freedom of Information request. See, this one came about when I was interviewing Dr. Mark Benoit when he was sounding alarm bells around the safety and efficacy of the Pfizer COVID-19 injection for adolescents aged 12 to 17. Dr. Benoit wanted the quantitative risk versus benefit analysis that justified the rollout of this injection in an age group not at all at risk of COVID complications. Sadly, the free speech censors are out in full force. And since we're already on the brink of being deplatformed from YouTube completely, we can't risk publishing this video in its entirety here. If you want to see the rest of this story, head on over to rebelnews.com directly. If and when big tech attempts to silence us, bringing you the other, often unreported side of the story, you can continue to find us at rebelnews.com and watch our content there from now on. For Rebel News, I'm Tamara Ugolini.